Chapter 18, The Cardiovascular System Blood, Part 2. Here's your table of contents. And we are starting from hemostasis. What is a hemostasis? It's a fast series of reactions for stoppage of bleeding. In case of tissues where injured, blood vessels usually are injured too, and bleeding starts. There are 3 stages to stop it. 1. Vascular spasm. 2. Platelet plug formation. And 3. Coagulation. The first one is vascular spasm. Here is your blood vessel. It's a small one that was injured, most likely ruptured right here. And it's bleeding. The blood is going out of it. Both red and white blood cells, blood plasma are leaking out. Those tissues right here, the cells were injured, and those injured cells release special chemicals that cause vascular spasm. It means smooth muscles of the walls of the blood vessels contract and make the diameter of the blood vessel smaller, and that reduces blood loss. But it's still not enough to stop bleeding. Second stage would be platelet plug formation. What that is? So those cells, injured cells, they keep releasing chemicals. Those chemicals go to the platelets. Remember those tiny cell fragments found in the blood, platelets, or they called thrombocytes, and platelets start swelling and produce such spikes, extensions. It means they are activated right now. Those activated platelets go right here to the site of bleeding and form the platelet plug. At the same time, they keep releasing chemicals. Now platelets release chemicals that attract more platelets. That plug, in case if it was a tiny blood vessel, a capillaris, or a small arterial, usually it's enough to stop bleeding. But in most of cases, it's not enough. And then the next step, coagulation, is required. So, coagulation is a set of reactions in which blood is transformed from a liquid to a gel. And that gel cannot go out, so that stops bleeding. And that gel reinforces the platelet plug formation with fibrin threads. So fibrin threads form a net, and that stops bleeding. There are 3 phases of coagulation. First, chemicals called prothrombin, which we always have in the blood, is turned into the thrombin. Thrombin converts fibrinogen into fibrin, and finally fibrin mesh is formed and stops bleeding. To convert prothrombin into thrombin, there will be a chain of chemical reactions to form prothrombin activator. Right here is prothrombin activator, and those 2 chains of chemical reactions are called intrinsic and extrinsic pathways. Let me explain all that in details right now. So what that coagulation is for? In our blood we have fibrinogen. Fibrinogen, that is short protein chains. Those short protein chains can be activated, linked together, and form a net. And that net traps blood cells and forms blood clot. Blood turns into a gel, and that stops bleeding. So in order for fibrinogen to turn into fibrin, we have many steps to follow. And those steps can start from two places. First, they can start from the damaged vessel wall, and that is called intrinsic pathway. It's triggered by activated platelets and collagen inside of the damaged blood vessel wall. So that's called intrinsic. It happens inside of the blood vessel. The second, extrinsic pathway, starts from those cells surrounding blood vessel that also were damaged. Those produce TF, tissue factor, or factor 3, and that would be extrinsic faster. Extrinsic pathway is faster. So each of those pathways finds special proteins or clotting factors in the blood. They all have numbers, there are several of them, and they activate each other. Each of them turns inactive, next one, into the active one. But both together, they form prothrombin activating factor. Even if one of those factors that don't have names but have numbers, even if one of them is missing, then blood will not clot, and that will cause bleeding to death. That happens in some genetic diseases, for example, condition called hemophilia. Okay, prothrombin activator right now is formed, and it catalyzes, speeds up transformation of protein prothrombin into the active enzyme thrombin. Next step, thrombin acts on fibrinogen, those are short chains, protein chains again, turning it into the fibrin. And it means that fibrinogen short chains are linked together and form net-like or mesh-like structure, and that would be your structural basis of a blood clot. So how blood becomes a gel? Red blood cells and white blood cells are trapped into that mesh and form a gel. So thrombin, with help of calcium, activates factor 13, which cross-links fibrin from short into long net chains, and also strengthens and stabilizes the clot. That's how the blood clot looks. All those chains are fibrin chains linked together, forming that net or mesh where red blood cells, in this picture there are only red blood cells, whereas they are trapped. I think that one may be white blood cell. Blood clot is formed and everything is just fine. Bleeding stops. Tissues start to repair itself. The blood vessels walls also are being repaired, and approximately within 2 days we do not need that blood clot anymore. So what happens after that? To remove the blood clot, we have a process that is called fibrinolysis. For fibrinolysis, a special protein that we have in the blood, plasminogen, is converted to plasmin by a substance that is called tissue plasminogen activator, or TPA, and also by factors 12 and thrombin. But that's the main one, TPA, tissue plasminogen activator. When plasmin is formed, it is an enzyme that is capable to digest fibrin. So, like scissors, it cuts that clot into small pieces, digesting fibrin, and blood clot dissolves. It disappears, and blood flow through the blood vessel right now is restored. Why it's so important to remember about tissue plasminogen activator? In case if a thromb happens in a place where it's not necessary, like during a heart attack, a thrombus is blocking one of the tiny coronary blood vessels, providing heart muscle with oxygen, tissue plasminogen activator is the only medicine that can save life. Before you continue, please stop the video and answer the questions for part 2.1. Now let's talk about disorders of hemostasis. There are two types of them. Thromboembolic disorders, it's when undesirable blood clots are formed in the places where they are not necessary. And bleeding disorders, it's when there is a bleeding, we need blood clots, but for some reason they are not formed. Thromboembolic conditions. First of all, it will be thrombus. Clot that develops and persists in unbroken blood vessel. It can block circulation, and when it blocks circulation somewhere, tissues do not receive oxygen and they can die very soon. Especially it's dangerous if it happens in one of the blood vessels, one of those coronary arteries supplying our heart muscle with blood, with oxygen. In this case, it is called a heart attack. So what causes that thrombus to form? That is a normal artery, which has very nice and smooth walls from the inside. And that is an artery that has a plaque or fatty deposits of cholesterol caused by bad cholesterol on its walls. It's not smooth. That fatty deposit is not smooth. So platelets, they think that there is a damage and they start forming blood clot on that damaged wall, already damaged. And thrombus is formed. Sometimes that thrombus can be torn away and separates itself and it starts moving through the blood vessels, and it can end up usually in small blood vessels of the lungs or brain. If it happens in the lungs, it's called pulmonary embolism, and it impairs the ability of the body to obtain oxygen. Dangerous. It's even more dangerous when it happens in their brain. Cerebral emboli can cause strokes, which often is a deadly condition. So how those conditions can be prevented? How formation of unnecessary thrombus can be prevented? By anticoagulants, substances that opposes coagulation. There are many medicines, aspirin, heparin, warfarin. Each of them is used when it's necessary. For example, heparin right before surgery and post-operative cardiac care. Aspirin, many people take a special type of aspirin on a regular basis, which keeps their blood a little bit more, let's say, less viscous, less thick. It thins their blood, and that prevents coagulation and unnecessary thromb formation. Bleeding disorders. Hemophilia is a disease where one or more of those blood clotting factors is absent. There are several types of hemophilias, and they all are genetic hereditary conditions, so they can be transformed from parents to their children. The most common type of hemophilia is type A, that is deficiency of factor VIII. Please remember that. There are also hemophilia type B, deficiency of factor IX, type C, factor 11, and many more. Person who have hemophilia will be suffering from prolonged bleeding. Even if they had a simple cut on their finger, it can bleed for hours, and the bleeding will not stop without a tight bandage. Especially dangerous it will be when bleeding happens if they fell down and internal blood vessels are broken, and it can cause bleeding into joint cavities, damaging their joints or inside of their internal organs, which sometimes can cause death. Hemophilias can be completely treated. They can be just treated with plasma transfusions and injections of missing factors on a regular basis. Blood transfusions. When blood loss is substantial, when a person lost a lot of blood, whole blood transfusions can be used. But usually, just to restore oxygen carrying capacity of the blood, packed red blood cells will be transfused without plasma. There are several types of transfusions, and if blood is mismatched, and it happens that patient received incompatible blood, it can be very dangerous or even fatal. What does it mean, incompatible blood transfusion? We all have different blood types. ABO blood groups, that's the first one we will talk about. So our red blood cells have their cell membranes, that is a cell membrane, and on the surface of their cell membranes, embedded in them, there are molecules called glycoproteins, protein part and glycocarb parts. In different people, those glycoproteins, or they also are called antigens, they have different shape. So if person with glycoproteins of one shape receive transfused blood with glycoproteins of different shape, immune system of that person can attack those transfused blood cells, causing blood transfusion reaction. It's dangerous. So those antigens, here are the antigens, they are unique to each individuals. Another name for them would be agglutinogens. So that's only when we are talking about different types of red blood cells and those glycoproteins on their surface. There are two terms that can be used. We can call them antigens or we can call them agglutinogens. Same thing for red blood cells. So presence or absence of each of those antigens is used to classify blood cells into different groups. We have 4 blood types according to ABO blood type groups. The very first one, look at this red blood cell. On its surface, it has only one type of those agglutinogens, and that is type B. So that would be blood type B. The next person has a different shaped agglutinogens, type A only. That would be blood type A. Finally, there are people who have both blood type A and blood type B agglutinogens. They have blood type AB. And finally, some people do not have neither A nor B agglutinogens on the surface of their red blood cells, and those people will have blood type O. Well, that's not it. That was about red blood cells and proteins on their surface attached to them. But inside of people's blood plasma, in that fluid surrounding red blood cells, there can be anti-A or anti-B antibodies. Or another name for them will be agglutinins. Those antibodies, they are special protein structures that can attack red blood cells. They can act against them. That would be blood transfusion reactions. We'll talk about them a little bit later. But you need to know that people, for example, who have blood type A, in their blood plasma, they have anti-B antibodies. So what happens if a person with blood type A receives a transfused blood type B by mistake? Those anti-B antibodies in their blood plasma will attack transfused red blood cells type B. That will be blood transfusion reaction. So a person with blood type A cannot receive transfusion of blood type B, and vice versa. pay attention that people with blood type AB do not have any antibodies in their blood plasma. It means that they can receive blood transfusion from type B, type A, or type A or type O. That's why they are called universal recipients. People who have blood type A, on the contrary, do not have any antigens on their surface, neither A, neither B, on the surface of their red blood cells. But in their blood, they have both anti-A and anti-B antibodies. If their red blood cells that do not have neither A nor B antigens, if that blood is transfused to any type, there will be no transfusion reaction, because there is nothing to attack. They don't carry those antigens. That's why people with blood type O are called universal donors. Pay attention to that table, and in that table you can see blood group types AB, B, A, and O. That is just a frequency of certain blood types in US population. You don't have to memorize that. But you need to know for each blood type, you need to know what antigens there are on the surface of their red blood cells. That's AB, so they will have both A and B. And what plasma antibodies or agglutinins they will have. Not in this case. Here it is. Also, for each blood type, you need to know what blood they can receive. Universal recipients, people with blood type AB, can receive any blood type. People with blood type B can receive only blood types B and O universal donors. And people with blood type A can only receive blood with type A or O. Universal donors can receive only blood type O. Otherwise, their antibodies will attack any other blood type. We have blood types A, B, AB, O, but you probably heard that your blood can be Rh negative or positive. What that is? There is another system of blood groups, Rh, and Rh factors are just another variant of antigens or agglutinogens sitting on the surface of red blood cells. So just a different types of glycoproteins, which are called Rh factor. There are several types of them, and some people have them. And if a person has that Rh factor on the surface of their red blood cell, we call their blood Rh positive. Here it is. Some people who do not have it, they are called Rh negative. So what about antibodies? People who are Rh positive do not have any antibodies against Rh factor in their blood. What about people who are Rh negative, who have Rh negative blood? They may or may not have anti-Rh antibodies. If they do have, it means they cannot receive a transfusion of Rh positive blood, because those blood cells transfused to them will be attacked by their antibodies. That would be transfusion reaction. We said that sometimes people with Rh negative blood have anti-Rh antibodies, sometimes they do not. What it depends on? Well, people who have Rh negative blood, they are not born having those anti-Rh antibodies. They only can develop it after the first exposure to Rh positive blood. When can it happen? It can be a result of a transfusion reaction, or it can be a result of during pregnancy. And how it happens during pregnancy, we'll see. Hemolytic disease of the newborn. Also, it's called erythroblastosis fetalis. It's when mother with Rh negative blood and antibodies against Rh positive blood can attack her fetus, her growing fetus, if that fetus has Rh positive blood. Why it happens? Let's say mother is Rh negative and father is Rh positive. And their baby, it's not baby, it's a fetus still, she's pregnant, is Rh positive. Mother, it's her first pregnancy and she doesn't have antibodies yet. But during the delivery of that baby, some amount of its blood will get into mother's blood. Rh antigens from the developing fetus can enter the mother's blood during delivery. In response to that, mother's blood will produce anti-Rh antigens. And when she's pregnant for the second time, and again the baby is Rh positive, those antibodies can cross the placenta and damage fetal red blood cells. As a result, the baby can develop hemolytic disease of the newborn. It's when baby's skin becomes yellow and some internal organs will be damaged. The baby can be treated with pre-birth transfusions and exchange transfusions after birth. But there is a way to prevent that situation, and mother who is Rh negative should receive RHOGAM serum containing anti-Rh to prevent the Rh negative mother from becoming sensitized. Okay, blood transfusion reactions. So how exactly those antibodies can attack antigens? So let's say there is a person of blood type A. Their red blood cells have type A antigens on the surface, and in their blood plasma there will be anti-B antibodies or agglutinins. If they are transfused the same blood type A, those anti-B agglutinins will not attack those new transfused red blood cells. They do not match. But what if a person with blood type A receives blood from type B donor? That donor's red blood cells on their surface have type B antigens, which match with anti-B agglutinins in their recipient. That will cause agglutination, clumping, connection between those antibodies and red blood cells. Sometimes several red blood cells can be clumped between each other with those antibodies. That causes agglutination, clotting of blood. And those agglutinated red blood cells can clog small vessels, and when they rupture, they release free hemoglobin into the bloodstream, which can be toxic for the kidneys and even can cause renal failure. And because there are so many red blood cells are damaged, it diminishes oxygen carrying capacity of the blood, which can be dangerous or even sometimes fatal. Please answer the questions for Chapter 18, Part 2.2. Let's talk about blood typing. Blood typing is a method to tell what type of blood your patient has. And that is a slide that we are going to use during the lab. You can see 3 wells here, a well for A, B, and Rh. And patient blood is dropped into all 3 wells. So we need to find out if the patient blood has any antigens. A for determining antigen A on the surface of patient's red blood cells, B for determining antigen B, and Rh for antigen Rh. Those are proteins on the surface of red blood cells, you remember. Next one, special serum containing anti-A or anti-B antibodies is added to the blood. So anti-A is added here, anti-B is added here, and going a little bit ahead, anti-RH also will be added in the third one. And if you see if agglutination or clumping happens in one of the wells, there's no agglutination here, you can see clumping happening right here. After the clumping happens or not happens, then you can estimate what blood type your patient has. In this picture, agglutination only happened in the well B. It means that the patient do not have any A antigens on their red blood cells, only B antigens, and their blood type is B. Nothing is shown for Rh in this picture, but if agglutination happened in this well, then the patient blood type would be B positive. If there was no agglutination in the third one, Rh, blood type of patient would be B negative. Here are a few more examples showing that is agglutination in both wells for A and B. It means patient has both A and B antigens on their red blood cells and their blood type is AB. Agglutination in A only, patient has blood type A. In B only, blood type is B. If there is no agglutination, it means that patient's blood type is O. And of course, always remember that each of the major 4 blood types can be either Rh positive or negative, so that is a total amount of blood types, 8 of them. Please, before you continue, stop and watch Blood Types Explained, and the link is under the video. One more thing for this chapter, diagnostic blood tests. There is a huge amount of them. For example, hematocrit, the ratio of the volume of red blood cells to the total volume of blood. And also microscopic examination of red blood cells. Those first 2 tests can show you if patient has an anemia and sometimes what type of anemia, judging by the shape of red blood cells. Differential white blood cells count will show you amount of each of white blood cells types, and if some of them is higher or lower than normal, like normal percentage of eosinophils would be 2-4%. If it's much higher than that, it may mean that patient is having allergic reaction. Complete blood count, it's both about red blood cells and white blood cells counting. Blood chemistry profile can include everything, absolutely everything, determining level of vitamins in the blood, level of ions, level of hormones, a lot of different things. And there are also different types of profiles, and some tests, blood tests, can be very specific, just checking one certain thing like blood glucose tests. Please remember to answer the questions for part 2.3.